Hi, I'm Sharon Pearson. Welcome to Perspectives. If you're joining the show, make sure to like, comment, and subscribe. You can follow me on Instagram at sharon.pearson.official. You can send us an email to perspectives@sharonpearson.com. Love to hear from you. Thank you so much for listening. Enjoy this week's episode brought to you by The Ultimate You book, available online and in bookstores. And here's the show. Hey everyone, I'm Sharon. Welcome to Perspectives. I am going to be joined today by the phenomenal Dr. Kate Gregorevic. She's a specialist medico, works with the elderly, and during the pandemic, she's been quite busy. It's been difficult to get her on the podcast. She's been at the front line, saving lives and writing or rewriting protocols for how to manage what's going on. She's got 3 young kids at the same time. In the middle of all of this, her first book, Staying Alive, has been released, which is fantastic. We're going to be talking with her today about her book and her philosophy of medicine and of care and wellness. It's a day-to-day lifestyle guide with tools to create our own framework to live our best life, but it's more than that. There's some really good science in there that I think we should all know about, utilise, and integrate into our daily living. So I trust you're looking forward to this as much as I am. As I said, it's been tough to get Kate booked on. And without any further delays, here is the phenomenal Kate. So I want to congratulate you, Kate. So firstly, it's Kate Gregorevic.
Yes.
Dr. Kate Gregorevic. And Kate's given me permission to call her Kate, but I want to congratulate you on your book, Staying Alive, which has been released. Congratulations.
Thank you so much. It was just an absolute labour of love to write. I just enjoyed so much getting into the science of aging, but also thinking about some of the social context of all of that.
Yeah, I could tell you had a really holistic view about it. One of the things, and firstly, how long did it take you to write this?
It took me about 6 months.
Well done.
Yeah, so it was just getting up at 5 a.m. every day and setting myself a word limit and getting on with it.
But you've got 3 kids, you're working full-time, and you wrote this book in 6 months. So how many hours did you give yourself? Was that 2 hours a morning or?
It's hard to remember. Look, it ebbed and flowed, and at that time I wasn't working full-time. But part of the reason I was able to write this book is because, I've done a science degree, a medical degree, and a specialisation and a PhD. So I already had a lot of the knowledge I needed. And it really was one of these things. I just felt like it was an important thing to do. It was really meaningful to me. And so I just set myself a schedule and stuck to it.
That's inspiring. Well done. There's lots of people saying they've got a book in them and that's it. That's as far as it gets and you followed through. So what's your philosophy of health and of well-being? Because I've noticed your philosophy isn't just try and fix it when it's broke. Talk to me about your philosophy.
Yeah, and look, I work in a hospital, so I do a lot of fixing when it's broke.
Yeah.
But I think I mostly work with older adults, and it is just the most incredible gift to get that wisdom and perspective that comes at the end or towards, after many decades of life. People in their 80s and 90s, they've lived. They have so much understanding of what is important. And don't get me wrong, physical things are really important aspects of health, sleep, nutrition, exercise. But we also need to find a framework and find motivation and find things that are important to us to actually feel like doing those things. And one of the other things about working with people in this age group, you also know that, life is finite. It does not go forever. And that's one of the most powerful things I think as humans that we need to come to terms with. And so in this book, I also wanted to explore a framework for how we can make these decisions to improve our chances of longevity, but also do it in a way that is putting importance on the here and now, on getting enjoyment, including emotional health and social health in, how we construct well-being.
So your philosophy, whilst you fix it when it's broke, how much of your true philosophy comes into the work you're doing? Because you work with older people in the hospital setting. Are you able to bring your philosophy into the work that you do? Is there space for that within the Australian system?
Yeah, look, there is, and it also depends a little bit. If someone's really, really unwell, it's a bit different. But even there are certain aspects that having these these emotional and social factors do still play in. And one of the things that I often ask my patients is, what is important to you? What matters to you? And that can help guide our medical decisions. You know, when people are unwell, you know, the one thing that's been really awful recently in hospital is that some of my patients have been in for weeks and haven't seen a family member. And that does have an impact on recovery. And, you know, it was a very necessary thing we had to do for safety. But it means that, you know, some people, we had the first visitors in yesterday, and to see the smiles on people's faces. And in my own research, I've looked at some of these factors, and these things do make a difference to recovery. So other than in the situations, I guess, where you've got the most unwell people, for most people, these do play into physical recovery.
So why do you think that is?
It's really interesting looking at the intersection of all of these factors, and it's really hard to pick apart. One factor that's been studied particularly well is optimism. And people who are optimists are more likely to make a good recovery after a heart attack. And there's a few different things that play into it. People who are optimists have more of a feeling that they're in control and feeling that things they do matter. So after a heart attack, they're more likely to take the medications they're prescribed. But there's also some other evidence that people who are optimists, it actually does have some biological effects. And one study looked at blood vessel health and found that optimists had better blood vessel health. So it's that really interesting intersection between the psychological factors and the biology coming together to affect the way our body works.
Okay, so with optimism, because I've studied that too, optimists also have the downside on they assume things are better than they are. Does that play out at all in what you're seeing? They can overestimate how well things are going, and absolutely. The downside of some of their choices. Said by a true pessimist, by the way. I'm fighting for my team.
And, you know, there's definitely some elements where it's good to have a realistic overview of how things are. I haven't actually come across specifically studying the more, as I said, most studies I've ever come across do have positive benefits of optimists. But I guess if you're an optimist who still feels like you've got a degree of control and that your behaviours make a difference, you're still going to get those benefits.
Yeah, that's fair. That's true. What about how much of the Australian system allows for prevention? Because the reason I wanted to speak with you is I'm all about prevention. I had a major illness from the age of about 16. I still have it. It's now managed through other ways, but it really woke me up to a system that was designed just to cut it off, cut it out, drug it. I actually had one doctor tell me once, because I had stage 4 endometriosis when I was about 17, 18. For years before, but diagnosed fully when I was 20. And one doctor said, if we cut the nerves, you won't feel the pain as it kills you. Not saying that's the standard practice, but that was my experience at 20. And it made me realize this is a very reactive system. Not the whole system, but I had a number of doctors over the years say it's in your head, because endometriosis was difficult to pinpoint. And I had a lot of experience of this. It's in your head. The pain will go away as you mature. It was a reactive kind of response rather than how do we go back to the cause? And you seem to have the philosophy of let's go back to the genesis of it. And everything about my podcast is genesis of ideas. What is the root cause of it? Not what are we dealing with now, which is literally just the outcome of all of these choices or all of these genetic factors previously. Where do you think the system sits now compared to my experience many years ago?
Yeah, and what you're saying is still absolutely a problem within our system. And we've got a system that, you know, the hospital I work at, when it was built, the main cause of death was infectious diseases.
Wow.
And, you know, an infectious disease, you treat it or people die from it.
When was that?
Pardon?
When was that?
150 years ago.
Yeah. When they didn't have the medical.
No, there was no antibiotics. No hygiene. There was less public health. You know, less water sanitation. No vaccinations.
150 years ago, surgeons were arguing with I can't remember. I feel terrible not remembering his guy. The first guy who said we should be washing the instruments and washing the hands. Surgeons argued with him and called it heresy. They were fighting for their right to use dirty equipment on people. Oh my God.
Yeah. Semmelweis, which I think I've just pronounced incorrectly.
We need to give credit. We'll put it in the show notes because both of the guys who figured it out deserve their credit.
Oh, 100%. And one thing in Australia, we spend a relatively low proportion of the health budget on prevention.
Yeah.
And the things that you were saying as well, is it's still an ongoing issue, and we don't have enough funding for allied health, for supportive management of conditions. It's hard to, unless you've got the money, it's hard to access a lot of those resources that you need, even just for psychologists. I think at the moment you can get 10 funded sessions. And, psychologists help people build skills to get through life and help, manage really complex conditions that don't just, magically fix after 10 sessions.
And I'm able to go to specialists in their fields to help manage my ongoing challenges because of that diagnosis and the outcomes of it. So I'm really fortunate. I go outside into the specialist system quite easily because of my freedom around being able to afford it. But that's not a choice some people are even aware of that they can have.
Yeah, and sometimes, there's also the public system does also sometimes offer really good holistic care as well, but it can be hard to access. Say something like chronic back pain. Once it's been excluded, there's nothing really nasty going on. It's often quite easy to get to a neurosurgeon and have surgery. But even if you're going to have surgery, it's still worth seeing a physiotherapist and making sure you're in as good a shape as possible.
Yeah.
And the way we fund general practice, it's so, I'm a specialist. General practice is so underfunded compared to what we get. And the way the Medicare rebates work, they get paid for seeing more patients rather than for spending more time with patients. And when you're running a business and you've got expenses, you've got competing priorities there.
Yeah.
And so, if you're
to churn and burn. How can that be? And I really get concerned about that, Kate, because I'm picturing older people who perhaps are alone. They want to sit down and talk about it. It could almost be literally all in their heads. But that plays out into the body, as we've just discussed. And they might just want to talk about it. Well, who's going to sit there and just listen to them chat about it? And I used to love how the practitioner used to be able to do that. I know I'm going back even before my time of seeing doctors a lot. But that's such a valuable way of our community coming together. Where else do they go? Supermarkets now, it's auto checkouts. There's no person-to-person. I really get really concerned about elderly in our communities. It's auto checkouts, it's auto banking. People don't want to stop and chat. Now with the virus, there's masks and there's perspex walls. So older people now are being challenged by technology, being told that they can't see anybody ever. And then they go to the GP and it's a 5-minute to 7-minute turnaround. Where do they just land and just be? And they're not going to Zoom it up. Even I'm over Zoom. I see COVID practices are bringing in a future that has even less space for the elderly to get this social community contact you've been talking about.
Oh, look, absolutely. And it's been so heartbreaking. I've had conversation, phone consults. I've had to do a lot of my medicine that way. Yeah. And people who haven't, hardly spoken to anyone in months. Mm. And they're so lonely. It's just awful. Yeah. But and I think that's why we've had to have an approach of really squashing down the virus, because it's not realistic to tell older adults, you just can't come out for the next indefinite future. We need to have a strategy that means everyone can get quality of life back, and hopefully we're heading towards there soon. But it certainly has been a byproduct of what we've been doing, this epidemic of loneliness, and loneliness has its own health problems.
I think masks has added to loneliness as well. I'm seeing people having less eye contact. I'm noticing some people who are older are darting away from people, so they're literally scurrying through. I'm seeing in my area there's quite a few older people, not all of them, but if you're going to notice any group that's doing it, older people are scurrying away from anyone in the aisles and avoiding eye contact, like eye contact somehow is a problem. Like, you're literally giving yourself the lowest possible quality of life right now. The way that you're behaving in reaction to it, especially when the case numbers come down, I just breathe. It's okay to have eye contact. Find connection where you can. If you're standing in the aisle with someone looking for something, it's okay to say something to them. So I'm doing what I can. I talk to every old person with a dog. I'm having eye contact with, literally it's like this, try and have eye contact. But it's a spit in the ocean compared to the fear that I'm seeing and the isolation that's being created because of it.
Yeah, and I think the fear of the virus has created isolation. And, people who are older with health conditions are right to be scared of the virus. And in some ways, masks are a way that we can make a bit more connection, because they do make things a bit safer. But it's how we're going to get past that and get, back to, we've made such dramatic changes in our society in the last 6 months, and how we're going to get back to that normal, those everyday little social interactions, which are so rewarding, that chat with the person at the grocery store, running into an acquaintance. These things are part of, I find them really enjoyable and rewarding and a part of the human existence.
It's part of how I feel community. I really do. I've had to make so many changes, but in regular life, it was all about just those moments. There'd be 100 people in my community I know just to chat to. I don't know if I agree with you on the mask, though. I understand why we've got them, but I find older people wearing a mask, not being able to see that I'm smiling, they're avoiding me. Whereas before, I used to have eye contact through the smile. I think this level of anonymity, and if for anyone on audio right now can't see, I'm holding the hand over my face, that level of anonymity, it's almost like we're creating Facebook or social media where you don't have to see the person, therefore you don't have to see them as a person. And people are not, in what I'm noticing is they're just not taking time with people. It becomes a transaction. Credit card, touch, get your stuff, gone behind perspex. And I'm watching these older people not have, and also their voices aren't projecting through the mask. They're not hearing as well through the mask. The number of sorries I'm hearing, it actually really stresses me thinking about how older people are, what they're having to do and what they're losing and maybe not even realizing it. And I'm going to validate the fear and then say all these other issues also really concern me.
Yeah. I guess it's having worked on the coronavirus wards.
You'd have.
And knowing how awful this virus is, I feel that wearing a mask, particularly in a space where we can't separate from
I agree with you. I'm not saying don't wear the mask.
But it definitely,
you're saying we connect with the mask. I'm saying I don't agree. Yeah. People aren't hearing each other. They can't project it. So, again, I'm going to say recognition of the reason, and then I'm saying all these other things are being lost. Yeah. And that really concerns me.
I totally agree with that, and it's actually really impacted on my care for older adults. And particularly when we were wearing the super tight N95 masks, they couldn't hear us, and a lot of my patients are hearing impaired, especially on the aged care wards, and it was really awful. And so, you're trying really hard to smile with your eyes, but you've got perspex and they can't see very well. And some of my patients who perhaps might have some dementia and might get a bit upset, the masks have been making it worse.
Yes.
It is a real sacrifice in our society that we are losing that facial communication because, it's so interesting. We respond to each other's facial expressions,
we have them. Evolution gave us all these hundreds of muscle movements for this moment, for the smile and the eyes and the wrinkles and the lift, all of this. This is something very unique to human beings compared to any other species on the planet. All these micro movements, having eyes that are white with eyes that you can detect are moving, eyebrows that lift the way they do, very unique to human beings for thousands of years, and now it's gone. That's got to pay up. Someone's got dementia. I was thinking about that yesterday. Someone's got dementia. They can't even read what's going on, let alone make sense of it.
It's really hard with people who it does definitely make people get more upset, and it takes away a lot of the strategies that we use to help people feel more calm and connected.
It would. Yeah, it would. And it makes, especially in aged care settings, I imagine it's becoming a lot more impersonal because the personal is so difficult because personal takes time. Can't spend too long with someone. Personal takes holding someone's hand, having longer eye contact and facial expressions. Intimacy is often physical touch. So a lot of the personal has had to be gone as we fight down the numbers. And I just really worry, and this is your specialty, the impact that it's having on them because of that. And as you said, social contact, optimism, feeling that you have control are the reasons why our wellness improves. We've taken away that. And I just really feel for the people who are experiencing that right now.
Yeah. And one thing I would say is that the specialised aged care nurses I work with are amazing.
Yeah.
And they're doing amazing work at overcoming that side of things.
Yeah.
But,
how so?
Well, they're incredible with the tone, body language.
Yeah.
With helping people find, I guess, trying to work out what's actually wrong when someone gets upset and finding alternate ways to communicate. You know, it's a really great skill that people have.
Mm.
Yeah, and it wearing, you know, as I said, it's one of these things. Hopefully we don't have to wear masks forever. I'm looking very much forward to when we get those vaccines.
I'm not counting on a vaccine. I reckon we're about 2 years away, and it'll only be as effective as the flu. It'll be like 50-50. And a coronavirus, we've never had an effective. So I'm not planning for that. I want a 15-minute result test.
Yeah, I guess
that's the game changer for me. 15-minute result test. Everyone coming to work and get tested. Have your life. Aged care settings, game changer in terms of visitors and the amount of time you can spend with people. I think it'll just free up our community. What about flights? 15-minute test when you get to the airport, 15-minute test again repeated when you land. That, to me, is going to free us up a lot quicker than a vaccine.
It's such an interesting area within the science, and it'll be really interesting to say which way things go.
Yeah. What do you think? Because we're down to 30-minute test.
Yeah, I'm a vaccine optimist.
Yeah, good. You are an optimist. That's right. Yeah. I'm not.
And also having read the research, having read summaries of the trials that are going on, and while we haven't had a coronavirus vaccine before, there's never been a lot of scientific incentive to develop a coronavirus vaccine.
Yeah.
My concern with the rapid tests is they may not be accurate enough.
Oh, they've got to be accurate. Or at least they've got to, if it comes back as a positive possible, it's an opportunity to then do a fuller test.
Yeah. And they've got to have a really good they've got to have enough sensitivity, so enough detection to make it actually give that level of protection. But
they just did a trial here in Victoria and it worked. They found the only positive case out of 1,000.
Yeah, and I guess it'll be in cases when if you had a high prevalence within the country. So it'd be interesting somewhere like the US to see whether it was effective enough, because we've got low prevalence in our society right now.
I don't think it's helping there.
Yeah, I know. I feel for them.
We're a small country. The joys of being such a small country that we can have a national campaign or a national policy, it's a game changer. They're dealing with 50-something states, all with their own views, very strong views, and a lack of a coordinated approach. I don't think the 15-minute test is going to do a lot there until they start rolling it out. But here, we'd be all on board immediately. Yeah. The state borders would come down.
It's actually been, for me, just, obviously the last few months have been really hard, but it's just been the most incredible display of why humans are so amazing. Because for most people, their individual risk of getting coronavirus and getting it badly is small. But everyone's seen what's going on. They've seen as a society what we need to do for the best for everyone and made these sacrifices. And, no other animal is capable of doing that.
Such a good point. That is such a good point. We should touch on it. I didn't know we were going to be talking about this today, but so you have worked on the front lines, because I did say in my intro we had trouble booking you. We had you booked and then had to reschedule because you literally went front line. Yeah. So where were you front lining? What were you doing?
Yes, I was working on an aged care coronavirus ward.
Yeah. And in Melbourne?
Yes, in Melbourne.
And that was what you were doing full time?
Yes.
Wow. So you would have been, can you describe it for us? I'm not looking for a voyeuristic view of this at all.
Yeah.
What was the stress like for you, or the feelings that you brought to it? What was it like for you?
Yeah. Look, I probably rather not go too much into the details, just because I'm very conscious that in the doctor-patient relationship, it's such a private space that I'm not share. I don't want to ever break that integrity.
No, I love that. It's great.
What I would say personally is that
for you,
it really made me dig deep on my own mental well-being strategies and the way that I apply a lot of what I've learned from all my reading, the stuff I've written in my book, to my own everyday life.
Yeah.
And so, things like I walked to and from work, which is about 4 kilometres, and it was really good to have that time to debrief. I actually leaned into exercise, made sure that I really kept that up.
Yeah.
I made sure I had a good sleep routine, and I tried to be really focused and present with my, those I love, with my family.
Yeah.
And, coming home, while I didn't really get a break because I was onto the parenting shift, it is something, children are so amazing at being in the moment and being really present. And so trying to just get into that a little bit and, the joy and fun in their everyday lives. So I really had to sort of, dig deep with some of those strategies.
So you took care of yourself so you can take care of others. It's the airplane, air mask analogy all over again. You made sure that you were giving yourself the oxygen first so you were free to be able to have the space to take care of others.
Exactly. And I say, we all deserve oxygen.
Yeah. Yes.
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 And so
self-care isn't a dirty word anymore.
Exactly. Self-care is not a dirty word. And so, I don't just put the oxygen mask on to take care of others. I also put it on because, I need oxygen.
Yeah, exactly.
And it really is. I think it's, we all go through stressful and hard times in our lives. And it is important that we find things that work for ourselves to get us through.
Good on you. And thank you for what you did.
Yeah, it's been an interesting year. So
it has been. Let's call it interesting, shall we? Because it's a G-rated show.
Yes, a bit more back to normal now.
So I enjoyed hearing about your philosophy. It was a longer conversation than I was planning on being. One of the things you said in the book really early, it was fascinating to me. In 1900, the mortality, we died at the average age of 31 compared to 80 now in developed countries and 71 across the board. Is that mainly infant mortality has changed?
Yeah, a lot of it's infant mortality because, it's if you ever read any historical things, the way children died was just horrific.
Yeah.
It's also better sanitation. And so things like working out that viruses or bacterial infections mostly bacterial infections could be spread through water. It's maternal health.
Yeah.
And, even my own grandmother, if she'd given birth 50 years earlier than she did, she almost certainly wouldn't have made it.
Really?
Well, yeah, she had a placenta previa, so her placenta was overlaying her cervix.
Yeah.
And so if that happens now, they know about it in advance with ultrasound.
Yeah.
But for her, the first they knew about it was she had a massive hemorrhage. And, she had an emergency cesarean and she and my aunt are totally fine to this day. Yeah. But in a time before that, she wouldn't have made it.
Yeah. So it was also antibiotics as well, wasn't it? Because she would have had – so it was infant mortality, maternal care and survival during birth, and also would you say antibiotics?
Antibiotics have been a part as well, yeah. But I think the public health stuff, which is, often a bit invisible, that shouldn't be dismissed. And in the more recent years, there's all the research that's gone into understanding cardiovascular risk factors. So that we go to the doctor and we get our blood pressure checked and our cholesterol checked. These seem so mundane, but they're things that we can intervene on and improve longevity and decrease the chance of getting chronic diseases. Yeah. And so there is a lot. Genetics of aging is really interesting, but I think it's really important that for the vast majority of people, genetics are not an absolute sentence to which how long your life is going to be.
Yeah, I come across a lot of people who do believe that I was coaching someone recently and I was a little frustrated personally when he said, there's nothing I think he was a doctor, there was nothing I can do about my health. It's the genetics. So he was dismissing a lot of the things you've written about. How is that attitude still perpetuating? Is there any science that's wrestling with this idea that I've missed, that it's all genetics? What am I missing here that's still in this year an argument?
Yeah, it is. It would be a minority view unless you've got some sort of rare genetic disease. Then no, they're rare, very rare. And there are also some people. Most centenarians do have excellent genes.
Yes.
So if you've got parents who live to over 100, then good work.
Yeah.
But for the majority of us, when you just look at that life expectancy gain in such a short period of time, that's not our genetics.
Keep going. How so?
So because, humans didn't develop the genes to survive to an average age of 82 in Australia when the survival in 1900 was 31.
Yeah.
That's all to do with getting better health measures.
Got it.
Yeah. And I even things like whether you get, some genes give people a much increased likelihood of getting dementia. And you can, send a swab away on your cheek and go and find out you've got these gene alleles that increase your chances. And I don't recommend it. Because if you do, whether you've got them or not, you still need to eat right, exercise, sleep, challenge your brain.
Yeah.
If you've got the low risk alleles, it doesn't mean you can take up smoking and spend all your life watching Netflix.
I love it when people say to me, oh, but my grandmother smoked and lived to 100. What is happening in their heads to justify that because they've got an example where the genes carried them through doing that, but all the evidence showing that's not the most likely outcome? What are they arguing there?
And I think it's, there is survivor bias. So,
yeah, good point.
The majority of them didn't make it to 100 and probably died.
Possibly.
But, people also, it's one of these things as humans, stories are incredibly powerful. And we do place sometimes more weight than we should on one person's health anecdote.
Yeah, we do. We do.
And we like to tell ourselves things that suit our lives a little bit. And so
we have a lot of cognitive biases to do that.
Yeah.
We really do. So the smoking stories, I'm thinking of someone particularly who smokes like a chimney, they look terrible. They really look bad. But they've got an example of someone who went for a long time smoking. So that's all they need. Forget all the research. And there must be so many human biases that encourage us or can trick us or convince us that the way we're doing it is fine and we don't need to make changes. So I read your book because I truly believe the reason I am healthy and work so hard on my health, Kate, I'm so dedicated to it, is because I had endometriosis and some other issues. It was a wake-up call. I never want to be that sick again. So I've literally spent decades now being as best as I can be and getting the research and being on top of it. I'm really motivated for it. I see other people, but not that many, Kate, who don't need that and just seem to really want to fight for great health and to be the best they can be. But I see other people, it's almost like no matter what happens, they still feel perceive they don't have a say in it. That's the way I see the three categories. How do you see it in your mind? I'm sure as an optimist you'll see it differently. That's how I see it.
See, I think one of the fundamental flaws in the whole idea of prevention is that it's an abstract future.
That's so true. That's it.
None of us actually know what's going to happen in 10 years, 20 years tomorrow.
Yeah.
And people don't often articulate this, but in our everyday choices, we are balancing that up.
Yes.
And that's why I think it's so much more important to focus on a definition of health that's really present, that's much more about enabling you to engage in your life, that's, that you can physically and mentally do what you want to do. And so then it makes it important in the here and now. And, my take personally is I'm not willing to make any major behaviour changes for my health that I don't get benefits from.
Now, you mean now?
Yeah, I mean now, yeah. Things like I'm very active. I exercise a lot.
Wow.
But, the thing that gets me up in the morning going for my walk or my run isn't thinking this is decreasing my chance of dementia. It's because I'll be in a better mood after I've done that.
I love it. Well, I have that view, but I keep investing in my future health bank as well. Do you think that's a healthy way to do about it, or should I change my thinking? Because I actually do invest a lot in my older age.
Yeah, I think it's fantastic for people who are in the right headspace to invest in their older age.
Yeah. I just consider all of these investments. I love the here and now. So the reason I take care of my finances to take care of when I can't earn. The reason I take care of my health now, when I'm older and I'll need to be able to draw on the deposits that I've made. So, for example, heart health. A number of studies showed where your heart health gets to at 70 is pretty where it's going to be. So I'm just making sure my heart health right up to 70 is as good as it can be. The other thing I really take care of, and you wrote about this, is telomeres. I am fascinated by telomeres. So can you share with us what they are, and then we'll have a chat about those? Big fan. When I found out about this, I made new decisions.
Telomeres are sort of like extra DNA on the end of our chromosomes. So the chromosomes are the little bundles of DNA. Yeah. And when they replicate, the way the replication works, it can't go to the very end. So you've got these extra little bits of DNA, sort of like the caps on a shoelace, so you don't lose any of the important genetic information when you make a new copy of the chromosome.
Yeah.
And so, on average, when someone's older, their telomeres are shorter. But there's been all sorts of studies linking other factors with telomere length. And that's really, really interesting. And it seems to be sort of a bit of a marker of aging.
So as you start with longer telomeres, and as you get older, they shorten. And when they get really short, that's it, that's the game, plus a whole bunch of other stuff you've spoken about. So what I've been interested in looking at is research and studies around how to lengthen telomeres or prevent their shortening. Have you had a look at that much?
Yeah, I have. And I think what's really interesting with this is that it's, again, there's physical factors, but there's also factors linked with psychological trauma that can shorten telomeres as well.
Yeah.
And I think it just really goes back. I'm not a fan of the idea that our brain health and our body health are separate.
Yeah, love it.
I think they're completely integrated.
Mm.
And, even saying something is all in your mind, well, your mind is still a part of your body. And I think it's so interesting that it gives us this idea of, a measure of what's been going on. One thing I would say, one small caveat is we need more longitudinal studies of telomeres.
Yeah.
And so there are some studies showing that, children who've been under psychological stress have shorter telomeres.
They do.
Which is really disturbing, but we don't entirely know what that means for their long-term health outcomes.
Yeah. We do. There has been a study that was done over a period of time. It showed, this is not my strength, paraphrasing terribly, but it showed that they had more chance of heart disease, diabetes, blood pressure, and heart issues.
Yeah. There are some. Yeah, there's links with those ones, but I mean, some, as I said, some of their. I don't like to overly worry people.
Yeah.
If they've, if there's been a study showing at a point in time.
Yeah,
those issues. And they definitely are linked with the longer term issues.
Yeah.
But I think it's just a general thing with some of this ageing research. We do have to be a bit careful how we apply it. And I don't want people
because it's point in time and it's for the study group and it's a mean. It's not everyone.
Exactly. I don't want people to lose hope.
Yeah, exactly.
Yeah.
The reason I find it useful is because I did experience trauma when I was younger. And so that I found that study empowering because I thought, okay, so these are the things I need to make sure I prevent happening in my own life, which is why I study positive psychology. It's why I do what I do. In many years of my life, I'm looking, okay, so that's what the studies show. It didn't make me lose hope at all. It empowered me entirely. Okay, so there is an actual physical potential here. It could, my psychology could potentially physically express itself. So what do I need to do to ensure that's not inevitable and I don't become the stats? So to me, it was incredibly empowering information. It's a very famous TED Talk, and I'm really bad at names. I'll put it in the show notes. But I thought, okay, so I just need to lift my game with those areas of my life. So my diet, I just really manage, my health, my well-being, the whole thing I'm looking at all the time because I don't want the potential to become probable. That's the way I look at it.
Yeah, and you sure you're not an optimist? Yeah, you can certainly.
Well, you say that. That's probably it. Do you think?
I think it's you.
Am I changing clubs after all these years?
Yeah. Well, yeah. I think it's you've got. I think you've obviously got a fantastic ability to, I guess, look to the future and to make these changes yourself. And I think a lot of the people who I see, it's taking almost that step back before that and actually finding the motivation to make positive changes. And often that is the hardest step.
Why? What's going on?
Yeah, look, it's interesting, I mean, things, and that's where I think as well with people when I'm talking about trying to get them to make some lifestyle changes to help improve health and well-being, it is often about saying to someone, what's important to you and helping them feel that they are worth doing, making these positive changes, helping them feel empowered, helping people see, have motivation to do something that is hard. Because, changing habits is hard. Like take quitting smoking. Smoking is hugely addictive.
Well, let's not use that because I don't call that a habit. I call that an addiction. I think there's a difference. So how come do you think it's hard to change a habit? Leave the hardest core addiction there is other than social media out of it. Just regular habits. What do you think? What do you notice is the constant pattern? Is there a pattern there on what people are resisting or what's going on for them?
Yeah, I think particularly in health, people do often have pretty entrenched behaviours.
Okay.
And they often have to overcome a degree of resistance, whether it's beliefs or whether it's beliefs about what they do and don't enjoy, whether it's, a way they've always done things. These things can be really hard to overcome. And that's why, when you're trying to find the motivation, it's not so much, saying someone, do your exercise. Everyone knows exercise is good for them.
Yeah.
It's saying, what's important to you. And if someone says, well, I love spending time with my grandchildren, it's, okay, well, being active is really great for that because then you'll be able to keep up with them.
Yeah.
And so it's framing it in people's lives, in what matters to them, what's going to add value to them. And I can't prescribe that. Someone's got to find it themselves.
Oh, the studies are really clear. The intrinsically motivated are going to do better than the extrinsically motivated every single time. There's also some other studies, Kate. I can't remember if it was in the book or not. A guy called Schneider and some guys worked out hope theory. And hope theory says where we believe we have personal agency and a pathway to achieve that which we feel we have agency around, we have more chance of doing it. I sometimes wonder if people who don't take the actions that are really self-evident, that they don't maybe have the same level of hope as others. So I am thinking I've been in the wrong club for a while. Maybe I am an optimist because I do. Thank you. I feel very loyal to the pessimist, though. I'm not going to abandon them. Because hope theory, and this is very much the camp I'm in, which is I believe I have a lot of personal agency, so a lot of ability to control and influence the choices I'm making around my health and my wellness. And I believe there are many pathways available to me because I make sure I'm informed so I have a number of choices. That literally is hope in action. So I wonder if some people, or a lot of people who don't take action, don't have the level of personal agency or don't perceive themselves as being empowered in that area as much as perhaps others do who seem to find it easier. Maybe that's part of it.
Oh, 100%. And sometimes that comes from life experiences. And, if someone's had a really hard, disadvantaged childhood, their life experience is that they don't have a lot of agency.
Yes, that's a really good point.
Yeah. And so it can be something that someone's learned, if someone's been throughout their life, perhaps in a marriage where they're very much under the control of someone else.
And their life aren't important. Yeah, there's a lot to consider. That's a really good point. So let's go back to telomeres because I don't think we've done them justice. So we left people hanging. How do we extend telomeres? What is it that you've noticed in the research that tells us we can do? So I take NR, and I can't remember the full name of it, but there's like 25 clinical trials showing NR extends telomere lengths. And I'll put in the show notes the full awful medical names, like that long. I'm indicating 1.5 foot here. But let's talk about non-supplement. What is it that you would suggest to help increase our telomere length?
So look, I think one thing with aging, it is multiple cellular processes. And one thing I was reading a study recently. They had a group of experts on aging at a conference trying to get a consensus statement on what aging actually is. No one agrees. 3
years later, they're still talking.
Pretty much. And so, having read very broadly in this area, aging is multiple factors happening.
Yeah.
You've got many different things going on. Cells are more likely to have DNA errors as we get older.
Yeah.
Our telomeres might be a bit shorter, which can also contribute to genetic instability. We've got less stem cells, so we're a bit less able to, replenish what we need. We've got more cells that are senescent, which is when they've had some damage. They're no longer replicating, but they're still kind of sitting there affecting all the other cells around them.
A bit like the annoying uncle, really.
Yeah, like the annoying, yes. Yeah, they're not, they do have some, the thing is they've also got some really important roles. So they have roles in tissue healing and they've even got roles in embryological development. But if you accumulate too many of them with age, they start to cause problems.
Yeah.
And so aging really it's multifactorial and it's related to a lot of really essential underlying biological processes.
Yeah.
And so with all of these things that I've looked at in my book, they affect telomeres, but they're also going to have effects on other parts of the cellular aging process as well.
Well, I picked telomeres because I read the whole book and loved it. There was so many areas we could look at, but I thought telomeres because then it would lead us, hopefully I was going to steer you towards our diet choices.
Yeah.
And exercise, because I know they're two of the things that can help, but that's okay. You didn't take my breadcrumbs, so I'll take you another direction.
It's just trying to choose one aspect of aging.
Oh, exactly.
It's like trying to choose a favourite child.
You would never want to do that.
Exactly. They're all impacted, and anything that extends all these things that are likely to extend your telomeres, they're also likely to have positive effects on all of the other aspects of aging as well.
Yeah. Well, one of the things I love that you write about that I'm just the biggest fan of is gut health and how you talk. I almost want to feed you the line so you say it because it's your line, but I feel I'm stealing your punchline, but you're not going to know where I'm heading because I'm not good at doing that. So I'm going to say it. I'm going to try and say it. There is gut bugs in your gut that have their own neurology, neurotransmitters.
Yeah, they do, and it's
that's mind-blowing.
You know, when I was at university, which was in the mid-2000s, we weren't really taught anything about the gut microbiome at all. And we were just told the gut, once you get to the colon, the digestion is done. And now we realise that no, actually it is so important, everything that's going on down there. It's this whole other huge component of health that was a complete mystery to us until very recently. Yeah. And so your gut bacteria want to make the best home possible for themselves. And they do that by partly influencing our own they can affect it. They produce their own neurotransmitters. They produce their own products that affect our colon cells that make things better for themselves. And so there's all these really interesting links coming out now between gut health and neurological disease.
I love this. I do on this one, Kate, feel that medicine's catching up on what perhaps we've been learning in some of the other fields. I had candida 20 years ago, and every doctor told me to take antibiotics, which would have killed the gut bugs I had. But I found someone else who took me a completely different pathway and gave me amazing health. It's where I live now, and I just love it. So are we at the point, am I going too far if I say gut bugs can cause depression? Are we there yet on that?
We're close, yeah. And there's some studies linking a high quality diet, lots of vegetables, healthy fats like fatty fish.
Yep. And low sugar.
Low ultra processed foods.
Yes.
Yeah. Linking that with actually being a treatment for depression.
Yes.
And it's relatively early days, but my take on things like this is that if I've got someone who's got these sorts of issues, getting them eating more vegetables is a pretty low risk strategy.
Yes, it is.
It may or may not work, but it's a pretty low risk strategy. And so I will give it a go.
And get them off the processed foods. I guess the one thing that's helped my health the most was dumping processed foods and dumping sugar 20 years ago. And it's not to say I don't ever have a treat, but those two things in terms of, because I was diagnosed with depression and I was given antidepressants. There was 4 different scripts I was given. And I'm not suggesting this to anybody else. It's just my story and my experience. I thought, this is reacting to what's going on, not dealing with how I got here. And that's where I made these major changes in my life. It's why I became a coach, because I didn't feel empowered with suppressing what I was feeling. I felt empowered the way you teach it. Well, how do we create the best and optimal playground for the best we can be? And that's when I dumped sugar, processed food, alcohol for 2 years. What else? And started exercising. What a concept. And I'm not saying it's going to work for everyone. This isn't me being a doctor. This is, all the disclaimers here. It's just for me, that was the pathway that taught me so much about how much I can impact me. It was so empowering for me after years of surgeries with endometriosis and ovarian cysts. It was 20 years. Just to empower myself that way. It was an incredible feeling. I loved it. And I'll always keep in mind, still today, every day, I feel gratitude for having my health, knowing what it felt like back then not to have that.
Yeah, gosh, that's such a powerful story.
Thank you.
Yeah. And it, it is one of these things that it's like ultra processed foods, as you say, that I think if people are going to make a change, that's something that, having them as a routine part of the diet, there is so much evidence now that it's terrible for your health.
Yep. Get off anything white. That's basically the way I live. Off white flour, sugar, they're the 2 main ones. Unfortunately, I'm off white wine because of the sugar count. I just get sick. I really do. It's like I have a hangover if I have a chocolate. I'm kind of grateful I have that, Kate.
Yeah, I have the same sort of thing. Sometimes going, because sometimes you want to just have a piece of birthday cake.
Totally. You just want to think, stuff I want to just eat normally. But do you find it kind of a good thing that you know you're going to have a hangover the next day if you have it?
Yeah, it's weird getting a food hangover, but it's one of the, like, I think as well, for me, nutrition is such a positive in my life. You know, I love food.
Yes.
And I love eating. It's just such an important part of what we enjoy every day, you know, sitting down with my family and sharing a meal together.
Yeah.
And sometimes we sort of focus so much on nutrition as being this, you know, we're denying ourselves. It's, you know, that eating well is means that we're not getting the most out of life. And I just completely reject that, because when you do focus on, you know, eating those mostly vegetables doesn't mean you can't have a lot of flavour, a lot of variety, and a lot of joy.
It's fantastic. It does take a while, though, I've got to say. Anybody who's hearing this going, that sounds really boring, it is for like 2 weeks. It actually is. When you stop adding salt to everything, you stop adding sugar and the processed, you know, trans fats, all that stuff, because I haven't had that in years. Food is a little bland for I think it was bland for me for 7 days. But that's because my gut bugs were used to having all that junk. So everything that went in, my senses couldn't fire up around it at all. It didn't recognize it as anything to fire up about. Now I couldn't go back and eat a processed whatever and get joy out of it. I'd be sick.
Yeah, and that's the thing I think as well. Like if I ever eat I almost never do eat ultra-processed things. Now they really taste terrible to me.
Yeah, how good?
I don't think they're actually tasty. They're exceedingly palatable, and they activate certain reward pathways and we call them want more foods in our house.
Yeah. Yes.
And when you start eating real food, you realise how much more flavour is actually in that rather than what you thought was flavour.
Yeah. I just think if anyone's hearing this thinking, I should make some changes, get Kate's book, Staying Alive, and she walks you through some really great dietary choices. But it's not a diet, it's just a health choice. It's a lifestyle choice. I'm not a fan of dieting. But what's great about it is you just know it's like giving up anything in the beginning. You don't know what to fill the space with. I always, when I coach people and we take something, they say, I want to dump that. Yeah, but what are you going to fill the space with? Because neurologically, you're used to having something there that gets you feeling a certain way. Everything we do, everything we want is because you want to feel a certain way. If you remove it, the feeling will be gone, but you still need to feel that way. So you're going to feel deprived. So you've got to fill it with something that will eventually become linked to the feeling you want to feel. Connection when you eat with family. So what can you do to make it look like there's platters of food, but they're going to fire up the feeling of emotion, but they're going to nurture your body. It's the same with stopping biting your nails. You lose that and the feeling of control is gone. So what can you replace it with that gives you a feeling of control and certainty, or freedom from anxiety? A lot of it's anxiety management. So I think a lot of the work I did to shift to eating really well was, okay, what am I going to replace it with? Not just take something away. I didn't just remove sugar. I replaced it with really fun things that I make that are really protein stuff that's really healthy. Anyway, that's how I've approached it and how I help my clients. What are you going to replace it with? Not what are you taking away? What are you going to do instead?
Yeah, and I think another part of that as well is just, you know, the way
that you're being an optimist again.
Yeah, I think you've really outed yourself today.
Yeah, I have. Yep, I can edit.
I think another thing that's really important as well is the way we speak to ourselves and not having an all or nothing approach.
Oh, yes. Good point.
And, you know, people are often, like I was speaking to someone recently and he said, I went to the gym today, it was really good, but then I had pizza for dinner. And sort of beating himself up because he'd had pizza for dinner.
Yeah.
And rather than sort of, you know, saying, I've done well today. And, you know, we never speak to our friends in the way we speak to ourselves.
Nice.
And focusing on the good things you've done for yourself is so much more motivating and social powerful, and not, you know, I had some cake today at morning tea. That means the day is a write-off. It's terrible. No, it just means you had some cake. That's it.
Yeah.
You know, it doesn't mean you're a failure.
I'm a terrible person. I've got no willpower. Actually, you've got so many messages bombarding you around you in your environment telling you to have that thing. Mm. It's a wonder when you're making the transition that I understand why it's so tough. But once you've made the transition, having the cake gets harder to do because the environment starts looking different. That's what I found anyway. One of the other things you talk about, there's so many things that I found interesting. You talked about inflammation. This is one of my favourite subjects when it comes to anti-aging. I call it youthing. rather than being against aging, I call it using. So can you talk us a little bit about inflammation and share your perspective on its role in how we can youth?
Yeah, I like that. I'm not a fan of the phrase anti-aging because, we are all aging.
Yeah, and I'm not against it.
No, I'm not against it because I like living. And so, enjoying the getting older process.
Exactly.
But, the immune system is so fascinating. It's so interesting and it's, absolutely essential. We need an immune system that is able to have a good inflammatory response to threats. Like when you get a virus or an infection, we need it to be able to, ramp right up. But then we also need it to switch off again.
Mm.
And the immune system is regulated by so many different factors in our lives. It's regulated. Exercise has an impact. Sleep has an impact.
Yeah.
Stress can have an impact.
Stress has an impact. Yep.
Yeah. All of these things have an impact on how well our immune system is able to work. And what we see when people are older, they can become frail. And so people who are frail, it means they've lost a lot of their reserve they need to cope with stress events in life. So, like getting an infection or they might have an adverse medication reaction. So things that might not have such of an impact on you when you're more robust have a much more significant impact. So, they might get a urine tract infection rather than having a bit of burning and stinging on passing wee, they can't get out of a chair.
Yeah.
And we know that people who are frail have higher levels of inflammation.
Mm-hmm.
So their bodies seem to be under stress. And it's still a bit of a chicken or the egg type thing of whether it's the inflammation drives aging or the aging drives inflammation.
Yeah.
I personally think it's probably a bit of both.
Okay.
But having immune dysregulation is a really key feature of aging. And higher basal
genetics as well, do you think?
It probably has a small component of it. But again, I think that there's a lot of lifestyle factors that have an impact.
Yeah, I think so, definitely.
Mm.
Well, I'm thinking there in terms of epigenetics, like what do we fire up through the lifestyle with, lifestyle choices from the age of 50 to 70 of junk food, processed food, alcohol and smoking and not exercising. And then I think that's clearly going to be more inflammatory environment within the body than someone who's got a different pathway. Whereas, you're right. So it's the epigenetics rather than genetics. Am I right there? Or have I just gone left field?
No. So your genetics do have an impact on how your immune system works.
Yeah.
Like as an example, women actually generally have stronger immune systems than men.
Yeah, of course.
Yeah. Right? that comes to the downside that women are a bit more likely to get autoimmune diseases.
Yes.
Yeah, but all of the things that we think of as, chronic diseases like diabetes, heart disease, dementia, they're all linked with higher levels of inflammation.
Yeah. And so what do we do to prevent that? What's your recommendation there in terms of some little things that we can do? So what can we replace with rather than take away?
Yeah, well, it comes back to these same simple strategies that, getting enough sleep, eating well, exercise, and maintaining your psychological well-being are all factors that seem to have positive effects on how our immune system works.
I think getting in nature as well. I make it a point every morning. The number of infections I've had in the last 30 years since I've been healthy has plummeted to a rate I simply cannot believe. Like, I can't believe it, Kate.
Mm.
I know I'm an anecdotal. It's not a study, but I know how many times I was anteing up for antibiotics or I was worried about the latest. I don't have that anymore. And I'm looking, what have I done? And it's really, I am moving, definitely moving, taking care of my mindset. So nurturing me and being a good friend to me has really helped, and taking care of what I put into my body. So I take care of what I look at, what I think about, and what goes in my body. So I'm trying to take care of what I see as the three major environments. That seems to be really working for me. And it hasn't been a major overhaul. And in some ways, one day I decided to change my diet. But in terms of connecting with nature, like walking down a tree-lined street rather than a concrete street, that's the kind of difference I'm talking about. That's really helped me expand into and feel good about my environment, so I feel good about me, which means I make better choices for my body. That's how it's working for me, I think. There's no studies for that, but I think that's what it is for me.
That's such an important point as well. Like, as I said, you can't really make health decisions based on anecdotes, but you know yourself.
It works for me.
You know yourself, you know what works for you. And that's the thing. This book has got a lot of scientific evidence in it, but it's also got to be how we apply it to ourselves. And it comes back to that really central message that it's, prevention is that it's an abstract concept. We've got to make it matter to us in the here and now. We've got to find a way to reconcile these wanting good health in the long term with creating joy today.
Yeah.
And so we do have to have our own individual strategies.
We do. One of the things that really helped me, Kate, I follow people like you on Instagram, people who look amazing. I know you're younger than I am, but I also follow a lot of people who are my age or older, who are really exemplars of taking care of themselves and thriving and striving and still have, they're still going for the dream and they have a clear purpose. Just to remind myself, and my mum does the same. My mum's 74, I think. I hope I haven't overaged her, but I think she's 74. She does the same thing. We keep sending each other photos of people who are just inspirational to us, who are older than us, and it really inspires us. We also we're yoga buddies. We are the worst at yoga in the history of yoga. It's awesome. We call it flopping around the floor but feeling happy. That's our name for yoga. And so having a buddy who's into it as well has really helped. So being around the mindsets of people who feel similarly that I do and are living and breathing that truth as you do, and also having someone in my life who's also into it. And, we're just regular people, but we send each other photos of us doing a silly yoga pose and failing terribly, or we'll send each other which yoga class we did that day. Just little moments like that are developing new habits for us constantly because we're constantly reminded it matters. It's mattering. This is a narrative we've created rather than a narrative of I let myself down again. That's been really helpful for me.
Yeah, and, I think as well we've got to have this. Most people are going to reach older age now. But we've still got these negative perceptions around it.
This is true.
All these ideas that somehow people stop having ideas or stop mattering, or, their thoughts are not of as much value because they've lived more years. And, that idea, people internalise that and it has harmful effects. And, you look at someone like David Attenborough, who's 93 now, and he's become this major environmental activist.
Did you hear the story this week about David?
Yeah, doing the shark tooth.
No, he went on Instagram for the first time and had 2 million followers in an hour.
Yeah. Yes. I follow him. I think he's amazing.
Oh, same here. Just fantastic.
Yeah. Jane Fonda, who I was listening to an interview with her recently, and she's 82, and her goal was to spend her 82nd birthday in prison, getting arrested for protesting climate change.
That is amazing.
And living her values. And
I saw the photo. I thought, more power to you.
We need to get rid of this idea that people are not as capable just because they've lived more.
One of the questions that asked to me a while back, when you envision someone being 90 years old, what do they look like in your mind's eye? Mm-hmm. And a bunch of people describe them all. They're hunched over and they're frail. And I'm like, no way. They've got their shoulders back. They're out walking with someone and they're gardening and enjoying their lives immensely. I think if we have a vision of how it is to be that age, that's what we kind of aim towards. One of the things that I don't know if I'm allowed to say this. We can edit it out if I'm not. I'm sure it's okay. But one of the things I find really shocking is there are dedicated areas for women on how to dress older. Have you seen men don't have it.
Yeah.
We have women's stores dedicated for older women to start dressing in the floral prints that perhaps we're supposed to start wearing at a certain age. Yeah. I told my mother, you ever go into one of those shops?
I know, but that's the thing, it's a social construct.
It is a social construct. I'm going to dress the way I feel and want to feel all my life. There is not going to be a moment when I'm going to make less effort and just think a house dress and slippers for me.
Exactly. Yeah, and one thing I would say, a common trait to the centenarians I've met, they don't take rubbish from anyone.
I love that.
They just don't take it.
One of my heroes just passed away, Ruth, so the Justice on the Supreme Court in the United States, Ruth Ginsburg. And also that lady in New York whose name I can't remember. She's in her 90s and she has the biggest wardrobe in the world, which is not necessarily a huge inspiration for some people. Do you know the one I mean? She wears way too much jewelry. And
Iris Apfel? With the
Yeah, you've done it. Yeah. The big glasses. I've got a book on her. They're the people who I admire and who I follow because I think, well, there's nothing they're holding together around in terms of they get attention because of for what we can do, which is a lot of Instagram is beauty and stuff like that. They've got a lot of core characteristics that I admire. They stand for what they believe in. They're outspoken in what they believe in. They're not trying to prove anything except how great they can live their lives. They're my heroes. I just think they're fantastic. Who are your heroes?
Yeah, who are my heroes? That's a great question.
Who do you admire in terms of health and well-being and living a great life?
One thing that's amazing in this book is I spoke to some of the absolute academic leaders in this field.
You did.
And so, as a clinician researcher, of course, they, people who I really looked up to were doing amazing work. And, the thing, a lot of them are past, retirement age.
Yeah.
And they're still at the absolute top of their field.
I love it.
And so, seeing women in my field who are still achieving so much, that's absolutely inspirational to me because that's what I want, going forwards. My work really matters to me and I want to be able to keep doing it.
Yeah, good on you. I love that. One of the things you mentioned towards the end of the book was, I'm going to try and get it accurate, going to ER, if you're a female. Do you want to take it away from here? Because I think I'm going to misquote you terribly. And
yeah, I think when you're going, so with I think women are still more likely to have symptoms dismissed than men, I think is where we're going. Yeah.
Yes.
Yeah.
Nice catch. Nice handball.
Yes. It still happens now. And, something I've called out colleagues on unconscious bias at work as well. And I hope they would do the same to me because I'm sure, you don't know you've got unconscious bias or someone calls you out on it. And it's one of these things that people, especially what they call atypical heart attack symptoms, which is really problematic because, 50% of the population are women. If they don't have the same symptoms, it doesn't make it, men are not the norm.
Huh.
And so this then has actually significant impacts. And women do have a longer life expectancy than men, but women having heart attacks are less likely to get the highest standard of treatment.
So what are we doing about that? Let's fix that.
Yeah, though there's a lot of work going into it at the moment from the heart disease side of things. But one thing that's interesting in an emergency department where they had more women, so women tend to be better at diagnosing this in women, but in emergency departments with more women, they teach their male colleagues to get better at it.
Good.
And so it's one of these reasons, gender equality, but also diversity in medicine is
Can't I just go into the medical training?
Sorry?
Can't I just go into medical training? Shouldn't it just be a class?
I think it is now. It's getting there.
Good.
Yeah.
If it's literally the studies are showing, that bias is there, fix it in the genesis when the thoughts are being formed about how we make assumptions about this.
Yeah, and I think that medical students now are just far more across these things than they used to be.
Good. I love that. So let's move to some solutions. You did put a lot of effort, and I want to give it the attention it deserves, about diet recommendations. So I'm a big fan of looking at blue zones around the world, and I think you've probably done the same as well. I find it fascinating. I lean towards the Mediterranean with a little bit of Asian kind of diet. What are some of the general recommendations you make in terms of what we should be putting on that beautiful platter when we want to connect with family and still eat healthily? Yeah,
so I very much focus that we eat meals, not macronutrients. And we need to take this...
Explain the difference.
Yeah, holistic approach to food, not a reductive approach to food. So I don't recommend cutting out, one macronutrient, cut out carbs. Carbs are a huge different...
So let's explain macronutrients. So that's carbs, fats and proteins. Go ahead.
Right. Yeah. And so take carbohydrates. Some people talk, I'm going to cut carbs. Well, carbs are a teaspoon of refined sugar, but carbs, lentils have carbohydrates in them. They can be the complex chains of carbohydrates that take ages for our bodies to break down, where most of that fibre gets to our gut.
Yeah.
So my approach is I try and make things really simple and understandable and achievable.
Yeah.
And nutrition can be spectacularly complex.
Yeah.
And the one thing you can take away from the sheer number of diet books is there is no one right solution for everybody.
Yeah.
And so what I would say is make most of your day, most of your plate, try and have vegetables on it.
Yeah. Well, there's two school of thoughts here around the studies I've been looking at. There's school of thought go major vegetables, plantarian, which is definitely me. And then there's the other showing really great results from people who focus mainly on protein, and have less of that. And they're getting really great results in both camps, which I find fascinating. I find that really interesting because I can't even imagine that. But there is longevity here as well and lack of inflammation if they focus on protein, but there's also the same over with the plants. I find that interesting. I don't know what to do with it.
There's more evidence around the plant.
Go the plant way?
Yeah, go the plant way. Yeah, there's more evidence. The blue zone people don't tend to eat a lot of meat.
They don't.
Similarly, the Mediterranean diet, traditional Mediterranean diet, isn't a lot of meat.
No, it's fish. It's mainly fish after you have salad and vegetables and eggplants, things like that.
Yeah. Or, the Okinawa diet, people in Japan. Again, not a lot of meat. There is more weight towards the plant side of things.
Well, meat, if you look at the Japanese diet, the Okinawa diet, it's this tiny little dish. For those of you on the audio can't see me, I'm holding my little hand so small, and it's that, and it's like pickled fish, or it's a meat that you have as a sample with all these 10 dishes of different vegetables. It's not a plate where meat takes up half the plate and then potato, which is very the way I was raised. I was raised in England. Very much it was the roast with the Yorkshire pudding and the potato and then maybe some boiled carrots that had been boiled for 20 minutes. That was how I was raised. So I had to uncondition myself to think in terms of Mediterranean with Asian. Have you been raised healthily, or did you have to recondition yourself, or?
Look, I was raised healthily, but I think, in the 80s and 90s, there was so much focus on low fat.
Yes, there was. Goodness.
And so I had to recondition myself away from that.
Yeah, that was me as well. I thought it was great. And I was told to have margarine as well. Don't even get me started. So I'm full fat, butter, olive oil. I can't gain weight having olive oil. That's the other thing I find amazing. I use olive oil on everything and my weight goes down or stays the same. Olive oil has just been the greatest gift from my diet ever. It just makes me feel amazing. Where are you? You didn't mention olive oil so much in the book. It got a bit of a mention, but...
Oh, it gets a bit of a mention. I mean,
my apologies if I didn't do it justice.
To mention, but I absolutely, if I'm using salads and things, I'm olive oil all the way.
Yeah. Now, the other thing, we'll just say the basics. Soda?
No. Yeah.
Let's just do like the pop quiz. Soda? No.
No.
Just no.
Just no.
Just no.
That's all.
Yeah. And preserved meats as well.
Yeah. Again, and the preserved meats thing, every now and then I do have a little bit of nitrate-free bacon.
Yes. But I've heard about that on the weekend.
Yeah, but by and large, preserved meats are not good.
No, exactly. And the other thing we haven't touched on, we'll maybe bring it home with this. You do a wonderful section there talking about, you cover sleep, you cover anti-inflammation, the vagus nerve, which we didn't get to talk about today. There's so many, and cortisol levels. So if you want to know more about that, obviously this podcast barely touches on what you should do. So I do recommend my posted noted book of Staying Alive by Kate. But one of the things you talk about is the holistic attitude about community and friendship and connection and mental health. You talk about Carol Riff's 5, well, she's got 6, but you include 5 of the ways of helping and generating wellness. Do you want to talk about that a little bit, about how that plays a role in what you're noticing in people who have longevity and feel great?
Yeah, look, the one thing I'd say when people, they've reached their 80s and 90s, when I say, what's important to you? They never say, I want to live as long as possible. Always tell me other things going on in their lives. I've got one story of a man who I saw who he wanted to get better from pneumonia because he was 90 and he'd always gone dancing with his wife for the last 70 years, and that was what was driving him.
Good.
And mental health isn't just the treatment of mental health disorders like depression and anxiety. And that's obviously really important, but it's a whole field of positive emotion. And so putting more positives in, thinking again of health as not just something, the absence of disease, but something better than that. And it comes as well with the book. I talk a little bit about happiness. And one of the things that I think is really important is to, distinguish happiness from pleasure. And I think if we just go and seek out pleasure for our entire lives, it's very unsatisfying.
Well said.
And it's not that it's not important to have little bits of pleasure in our day, but humans, I think we have a deep need for something more than that. And, happiness is this sense of doing. Happiness is this sense of living our values. And when I see people who are older who are really thriving, that is really integral to their lives.
I love that. I'm doing my final thesis on my master's on that, literally that topic. I talk about hedonic happiness versus meaning happiness. I come down way on the meaning side. And for me, it's about having a sense of purpose, so having a vision for myself and my life. Even having a vision board is a great way of going about envisioning the life for myself, for the here and now and my future. Then it's values-laden living. So what are my values? I revisit with my husband every year. We have for 20 years now. What do we value? What do we care about? What's going to be our focus for the year ahead? And then actions that are aligned with that and give us joy. So moment-to-moment decisions become easier because they're really integral and completely tied up with what we value, what we care about, what we stand for, what we're fighting for, what we invest in mentally and emotionally. One of the ways it's come to life during this virus lockdown is we go to a different city every Saturday night. So last Saturday night we went to Balthazar, our favourite restaurant in New York. Yeah. And we had French food and French music, and I dressed French, and he had a French hat on. I think this Saturday we're going to Tuscany because we had a bottle of olive oil delivered from Tuscany, and that gives us a great sense of meaning. It's very pleasurable, and it does take care of the hedonia and the feeling of pleasure, but we're really investing in what we care about, which is our intimacy and us being close together and us feeling that intimacy in a fun, playful, silly way. So literally I'll wear an Italian scarf. It's that kind of thing. So I'm with you. I hear here on having a sense of meaning, not just the feeling of moment-to-moment pleasure. It can be interwoven together. I think all the studies are showing the same thing, Kate, that both coming along on the journey without sacrificing one is going to give us out. It's not that break even, I feel fine, I don't have anxiety or depression. It's I feel great. We're going to the positive end of the axis. I feel great. I feel my life has wellness and wholeness about it.
Yeah. And one thing, when people get older, they generally actually get happier.
Yes, they do.
And I think it's to learn these skills.
Yeah. Yeah, and they care less about stuff that when we're younger we think matters so much, which is a huge relief.
You want to be a teenager again, right?
No, I did so badly the first time. I can't do it again. Don't make me. So yeah, people can reach you at the website is
Project 3612.
And what's it all about?
So what that's all about, it's a women's health and wellbeing courses specifically aimed at women who are 40 plus and who want to make some positive changes to their health. So it's got a strength training component, it's got recipes, and it's also got some health education webinars done by myself. Oh. And I made that in conjunction with an exercise physiologist.
Oh, congratulations. I love the stuff you're doing. I love your holistic approach to this.
Yeah, thanks. Yeah. I wanted to make something because there's so much out there focusing on weight loss for women. And I wanted to focus on people actually getting healthy again, because they deserve oxygen.
Yeah.
And so trying to make people actually feel that these things are good, enjoyable, that they're valuable in themselves, and to not face a lot of the barriers that women face to looking after themselves.
Yeah, congratulations. I think you've achieved that. Really worth following along. Thanks so much. It's so lovely to connect with you.